Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, April 23rd, and this is my daily briefing. We've had a total of 41 cases to date in Missoula County. 39 of those cases were identified by testing, and 2 were epi-linked cases. We have 33 cases that have recovered, and we've had 1 death, which leaves us with 9 cases that are currently in isolation. The state of Montana has had a total of 442 cases and 14 deaths. We've had people confused about cases, hospitalizations, and some people think that we've already hit our peak. We know that we've had 41 cases in Missoula to date. We have had five people hospitalized with a broad range of ages, and there's no evidence that we've hit the peak or that the worst of this is over. If anything, right now, we're concerned that as people increase activity and start interacting with each other more, the milder or unrecognized cases in our population is going to cause our case numbers and hospitalizations to increase. So I just want to take this opportunity to remind people that it's really important that even as things start to open back up, that we still need to practice those measures that we've had in place, such as social distancing and keeping that 6 feet of distance between you and people who are outside of your own household, making sure that you're still using cloth face coverings whenever you are out in public and interacting with people. And always remember that it's important that if you start to develop symptoms, it's really important to just stay home and get tested. Yesterday, Governor Bullock announced his plan to reopen Montana and rescind the stay-at-home directive. The directive ends for individuals on April 26th and for some businesses on April 27th. The governor's plan necessitates the need for continued social distancing and personal hygiene and gives local jurisdictions the ability to assess local needs and provide for more stringent measures. Our local health officer is evaluating the plan and assessing if additional guidance or local considerations are needed in order to continue to protect our community, our essential workers, and our healthcare hub. Additionally, our environmental health team is determining what's needed to assist as businesses try to work through this transition. To clear up any misconceptions, we did not open things up. Rescinding the stay-at-home directive was not a local decision. And as we've mentioned before, we've been under the governor's orders for several weeks now and not local directives. So those of you who are frustrated or confused by this, we totally understand, again, that we are assessing things and trying to figure out what makes the most sense for our community. Many of you want to know what this means for you, and we totally get that. What we can say at this time is that the governor's plan encourages individuals to continue good hygiene, social distancing, disinfecting common surfaces, using the cloth face coverings where social distancing is difficult. People who are sick need to stay home except to seek medical care. If you have symptoms of COVID-19, such as coughing, fever, or difficulty breathing, you should contact a testing center so that we can make sure that you get tested. Those in the vulnerable population should continue to stay at home, and employers are encouraged to work with high-risk individuals to support social distancing needs. The governor directs employers to conduct employee temperature and symptom checks and asks employers to seek out industry best practices and implement policies on social distancing, disinfection of common surfaces, and use of high traffic and common areas where customers and employees may gather. Employers should encourage teleworking whenever possible, especially for vulnerable populations, or provide alternate work schedules in order to reduce the number of employees at a work site at one time. Businesses need to minimize non-essential business travel. Until May 4th, restaurants, bars, breweries, distilleries, and casinos are still limited in operation as under the previous directive. Takeout and delivery are still permitted. Pools, gyms, hot tubs, and places of assembly like theaters, music halls, bowling alleys, bingo halls all remain closed under the governor's issues and until the governor issues another directive. Visitation is still limited at senior living facilities, nursing homes, and assisted living facilities, and schools are still to remain closed until May 7th, at which point the local school boards may choose to reopen the school. As soon as we have additional local guidance, we will let you know. Figuring this out has been a priority for all of us, and we recognize that things cannot stay closed long term, but we also want to be very measured in our approach and provide our community with the guidance that they need to do this right. We also want to make sure that all of the hard work and sacrifice that everyone has made over the last few weeks, we still want that to matter. We don't want to have a huge spike in cases or later or longer closures. So please just bear with us as we try to work through putting together that guidance. We do plan to have that guidance out by the end of the day tomorrow at the very latest. We've gotten some questions about a letter that was circulated from one of the environmental health folks to body arts and salon studios. We're sorry if this letter was confusing, but simply put, the goal of the letter was to let you know that the governor's closure still applies to you through April 27th and that our local health officer is reviewing what to do locally. Once that decision is made, our department will make that information public and provide appropriate guidance. We've already heard from operators of a variety of businesses, including body art studios and salons, providing feedback on opening and operational parameters. As things are taking their first steps towards trying to be normal, I just want to highlight that the Board of Health's strong recommendation for cloth face coverings that was issued last week is even now more important. The governor echoed a similar message in his directive, press conferences, and town hall meetings yesterday. So if you are in a public space where social distancing is hard, such as a grocery store, pharmacy, please wear a face covering. This applies to customers as well as employees. As we've said before, the cloth face covering isn't about you, but it is about those around you. There are people in our community who are at higher risk of developing complications from COVID-19 who still have to go out in public and they still have to go to work. And a face covering on you could also help them. It's a community protective equipment, and we really need to just embrace it and normalize it. So I know that that's not necessarily all of the answers that you would have liked to hear me say today. The real answer that I have for you is just please be patient with us as we are working diligently to make sure that we're doing the best that we can for our community, and we do hope to have more information by the end of the day tomorrow. So that's all I have for my daily briefing for today. As always, you can subscribe to me on YouTube under my name, Cindy Farr, that's CINDYFARR. Follow us on Facebook at the Missoula City County Health Department. Call 258-INFO, that's 406-258-4636. If you are having symptoms of COVID-19 and would like to get a free test done, they can help you make an appointment at that 258-INFO line. You can also call that line if you have any questions about COVID-19 or would like to get connected to community resources. And also you can check out our website at missoula.co/cvirus. I just want to say thank you for everything that you're doing out there to help us keep our community safe. Please just be patient with us a little bit longer while we try and work out the guidance. And with that, I will talk to you all again tomorrow. Stay healthy.